Hello there, my listeners. My name is Nath, your antimicrobial steward, and I would briefly like to talk about get well soon without antibiotics. Now, this brief video underscores or emphasizes and explains the need to get the correct or right treatment for the common illnesses we encounter in our day-to-day lives, such as colds and coughs, without encouraging or driving antibiotic resistance. Now, next, I would like us to discuss how we can manage the colds that we encounter in our day-to-day lives. Now, the best way to treat most coughs and colds or sore throat is by hydrating properly through drinking of plenty of fluids and through getting quality bed rest. Now, colds can last about 2 weeks if untreated, and they may end up with a cough which involves bringing up of phlegm from our respiratory tract. Now, out there are many over-the-counter or OTC remedies that can help ease our suffering, such as paracetamol that we can use to manage fever and pain that accompanies these viral infections. Now, I would encourage you to ask your pharmacist for advice before you self-medicate, because some of those drugs that we buy over the counter can end up driving resistance or affecting our quality of life through adverse drug reactions. Now, how about those parents with a challenge whereby their kids experience recurrent coughs and colds? Now, it's very common for children to get coughs and colds. They cross-infect one another. Now, when these children go to school and mingle with fellow children, reinfection can occur even after we treat them. So I would urge you to ask your pharmacist for advice when this occurs, and if such symptoms persist and you're concerned, then the next step would be to consult or see your pediatrician or doctor for further care. Now, when we go to the doctor, we shouldn't always expect to have antibiotics prescribed for our. Next, I would like to explain why coughs and colds should not be treated using antibiotics. Now, all colds and most coughs and sore throats that our children come down with are caused by viruses and not bacteria. Now, antibiotics do not work. They are not effective against such infections, such as common cold, which are caused by viruses. And viral infections such as these are more common than bacterial infections, especially in the upper respiratory tract infections. They account for around 90%. Now, the patient's body, in normal circumstances, should mount an immune response. It should combat these viral infections. Apart from that, common remedies such as lemon, honey, and ginger can give our children or our sick patients some form of relief. And in addition, we can manage fever accompanying such infections using paracetamol. Now, if sneezing is a bother, antihistamines may also offer relief, but we need to be cautious with the use of these antihistamines, as they could cause over-drying of membranes such as that lining the nasal cavity, and this can cause cracking and make the nostrils prone to infections, which may further complicate our patient's conditions. So next, I would like to define antibiotics. Now, antibiotics are very important medicine that are used to treat infections caused by bacteria. Now, the bacteria that we try to manage using antibiotics are in a position to adapt and find ways of surviving the effect of these antibiotics that we use. Now, they can do this by pumping out the bacteria from their cells. Now, they can also do this by secreting enzymes that can break down the antibiotics that we use to manage them. And the more that we use these antibiotics against the bacteria causing the infection, the more the antibiotics are likely to develop resistance. And the end result is that such antibiotics can no longer work against these bacteria when they cause infection in our patients. Now, some bacteria that cause infection in a hospital, such as MRSA, are resistant to several antibiotics. Now, this makes treatment of such infections very costly and increases the likelihood of death and may lead to prolonged hospital stays. Now, when we misuse antibiotics in treatment of viral infections or in common bacterial infections, what happens is the susceptible bacteria die. Now, the resistant ones may thrive and multiply when there is reduced competition as a result of the death of the susceptible bacteria. Now, this may end up selecting a population of drug-resistant bacteria, complicating our treatment. Now, next, I would like to respond to the question, why can't different antibiotics be used instead when treatment fails? Now, most bacteria that we have in our market today tend to kill specific bacteria. In other words, they are selective in nature. Yes, they can kill bacteria, but they may not be as effective as we'd like them to be in all kinds of bacterial infections. And the downside is the side effects they cause may be more of a bother, and this may end up driving cost of treatment unnecessarily. Now, we eventually end up with a case where the bacteria become resistant to such infections too when we misuse them. Now, we cannot be sure whether we'll always find new antibiotics to replace what we have currently today. So we are advised to use what we have wisely. Now, in the recent past, there are fewer new antibiotics that have been discovered than we would like to. In other words, our pipeline is dry. Now, the reason behind it is that it's no longer a profitable venture for the pharma industry, since no sooner do they release new antibiotics than the bacteria develop resistance to them. Bacteria develop resistance to everything that we use to treat them. So next, I would like to talk about how we can avoid resistance by this bacteria. Now, we can do this by using antibiotics less often that can help us with slowing down the development or emergence of antibiotic or antimicrobial resistance. Well, it's not possible to stop the use of antibiotics completely, since bacterial infections are fairly common in our day-to-day life. Now, slowing down the use of antibiotics stops or helps curb the spread of resistance. Now, this buys us some time as we work on modalities of producing newer antibiotics that we can use in. How else can we curb the emergence of antibiotic resistance? We can also do this by appreciating the fact that by only using antibiotics when they are appropriate, we minimize driving the emergence of antibiotic resistant strains. Now, we know that most common coughs and colds that we experience in our day-to-day life get better just as quickly without necessarily using antibiotics to treat them. So let's avoid the use of antibiotics in managing common coughs and colds. Now, when antibiotics are prescribed, I would urge you to complete the prescribed course in order to get rid of the bacteria causing these infections completely. Now, if we don't complete our antibiotic courses, some bacteria may be left behind. They may multiply or proliferate, driving the emergence of antibiotic resistance. So when will antibiotics be prescribed? Now, your doctor or your healthcare provider will only prescribe antibiotics when you need them in circumstances where the infections are caused by bacteria. For example, kidney infections or pneumonia. These are commonly caused by bacteria. Antibiotics may be life-saving for infections such as meningitis as well, which is common in our children. Now, by not using antibiotics unnecessarily, they are more likely to preserve their effectiveness or their efficacy, and they are likely to be effective or to work when we need them most to manage bacteria. So, dear listeners, I would like to urge you to only use antibiotics when prescribed by your doctor to manage bacterial infections. Avoid using them in the management of most upper respiratory tract infections, which are majorly viral infections such as a common cold or flu, so that we can preserve treatment options for our future generations to come. Thank you. And if this video helped you in any way, make sure you give it a thumbs up and remember to subscribe to my YouTube channel. The best is yet to come. Thank you for watching and listening, and have great antibiotic stewarding. Thank you.